Okay, so we're trying to look at another aspect of radiography, and this is what we got. So this is all around patient assessment before the radiography procedure. Do you understand? What are the things you should actually check on your patient before you guys start anything, like, you know, conversing on anything imaging? So first you have to identify your patient. You have to confirm your patient. You have to verify your patient, because you don't want to take a particular treatment for a different patient and give it to a different patient. How about clinical history? You know, so you look at the notes that's on the request paper for imaging. You look at some things that they wrote. There's some other things that they wrote. You just take note of it, and the disease condition that the other healthcare professional is also suspecting for. So you check if the patient is pregnant. Of course, that one is a special case. You assess if they have allergies. That's probably when you need to give contrast. And you identify if they have implants, prostheses, or any medical device. And make sure that all these necklace, keys, they don't have them on their body. And the type of clothes they are wearing too. There's no zips, you know. So physical and functional assessment is you evaluate how your patient is able to move, and how your patient is able to take instructions. So if you tell them to remain at a particular position, how well could they actually, you know, obey that? So consent and communication, you still introduce yourself to the patient. You still tell them what you're about to do to them, in as much as probably the other medical exam professionals actually what explain it to them, you still explain to them, and they have to still agree. Okay, and if they have questions, you have to answer those questions judiciously. Okay, so monitoring during radiography. So radiation safety. So in as much as you be imaging the patient, make sure that the amount of radiation that patient is exposed to is just what is needed for them. So you also use shields. You make sure that your patient is comfortable. You make sure that your patient is positioned right. They monitor if they are discomfortable, or if there's any pain, or if there's any distress at all during the positioning. So vital signs, you observe breathing, heart rate, and consciousness in vulnerable patients. You know, image quality control, you check exposure factors, you know, positioning and clarity of the images. You repeat only if necessary. You know, you minimize radiation exposure, and after the radiation, you know, just provides good instructions. Most of the times they need to take a lot of water after being exposed to radiation.